Good afternoon. Yeah, the decision comes as Oregon's indoor mask mandate was set to end tomorrow. And while state health officials are talking about ending the mandate, they say you're still going to have to continue wearing those masks for several more weeks. On Monday, a big announcement for Oregonians and a possible turning point in the pandemic.
So we're announcing the extension of masks as well as what the endpoint is for masks together so that people can make decisions.
Dr. Dean Sidelinger, health officer and Oregon State epidemiologist, says with more than 1,000 Oregonians in the hospital with COVID, masks in indoor public settings as well as the K-12 school setting will be extended until March 31st, but no later. The mask requirement could be lifted sooner than that for public indoor spaces.
Having these requirements in place for the next several weeks is important as we get case rates back down, return to a level where hospitals are better able to care for patients without the strain that they're experiencing now.
By late March, the state expects 400 or fewer Oregonians will be in the hospital with COVID. While the masking requirement is expected to be lifted by March 31st for indoor public and K-12 school settings, they will still be required for those in healthcare settings.
These are settings that serve all Oregonians, often some of the most vulnerable, most at risk for complications from COVID.
When it comes to businesses and employers, they'll be able to establish their own masking rules for customers and employees. That goes for individual school districts as well.
How likely is it that the state would then revert back to a masking requirement? What would conditions have to be?
I think it would be unlikely that we'll see, reimposition of mask requirements broadly across Oregon.
So Dr. Sidelinger says he doesn't see a masking requirement coming back because the vaccines and boosters that are so widely available, as well as the preventative medicines that are being developed and distributed. Although health officials do say for those people who are at higher health risk, they do recommend those folks continue to mask up. Back to you.
All right, Christine, thank you so much for that.